Hello and good morning, all of those fans and followers of the Home Health Mentor. This is Amy Register, the completely unprofessionally associated, completely sweatpants wearing daughter of Teresa Register, who is a consummate professional. I'm here really just to introduce topics and keep the flow moving, looking at comments, welcoming you. I totally expect to see some familiar names and faces pop up. So I'm just going to go ahead and say it. Welcome, Janesh. Welcome, Sarah. Welcome those of you who have been with us the first 2 weeks. We're just trying this out. And today our topic is a little bit about mock surveys, a little bit about quality as kind of the root and focus of, well, really everything that you guys are doing in home healthcare. But today we're going to have Teresa kind of pull back the curtain on the magic of mock surveys, what they do for you, and kind of get you a little bit prepped and excited for doing a mock survey in your agency. So welcome to Teresa Register, the Home Health Mentor. And Mama, get us started off here with just since it's new, we're going to do this for a few weeks. Just give us a sense of what you've done in the home healthcare industry so people can know your background. A couple sentences.
Okay. I've gone over this before, but maybe if there's someone new, I have been in the industry for over 5 years now, and I've done everything from direct care, middle, senior, and regional management. And I was a surveyor for CHAP for 7 years. And I currently am the compliance auditor for a large home health agency in Texas.
All right. Thank you. Yeah. Guys, we don't mean to repeat, but just as we're getting started and people are unfamiliar, your audio cut out and it sounded like you said over 5 years, but I know that it's way more than 5 years. Over 35 years.
Yes.
All right. So take us, let's peel back the the magician's secrets today and tell me a little bit about what a mock survey even is and why an agency would be considering doing one or two.
Okay. Well, last week I mentioned that my plan for this week was to begin to lay a foundation for agencies who would like to conduct their own mock surveys. So, yes, you do have to understand what a mock survey is, which is a systematic review of the same kinds of things a surveyor would be looking at, but you do it before your survey, your anticipated survey date. So you can identify problem areas and give your agency time to correct those. Although a lot of agencies have consultants do mock surveys, for some agencies, the cost is prohibitive. So there are some good reasons.
What are we talking? How much can it cost to have somebody do a mock survey?
It would not. Yeah, it would not be uncommon for a mock survey to be 2 or 3 days long at maybe $1,500 a day plus expenses.
Okay.
So yeah, it can be costly. Of course, if you look at the cost of making errors, the cost of a mock survey may be well worth the money. But
absolutely.
But it's good if you can do your own, which is why I'm trying to focus on some of the things that agencies can do to do their own surveys.
Okay. So just to summarize, a mock survey is kind of like a fire drill. It's all hands on deck. You try to get it. It's a dress rehearsal. You're trying to get as close to actual conditions as possible and preempt any problems. And then we are not here to dog on any consultants. We absolutely believe that that's the kind of thing that's definitely worth investing in. But if you're just getting started, you could save a lot of money by doing it yourself. So what else do we need to know? Why do we need to have them? Is it just to do a better job on your survey, just to know
Uh,
what your issues are?
no, obviously, there's some other reasons. So first, you want to find problems before a surveyor does, which will allow you to avoid citations and the possible penalties that are associated with those citations, which can be huge, anywhere from $12,000 to $20,000 a day, depending on what the problems are that are identified. Secondly, you want to do your own mock survey or have a mock survey so you can do a good root cause analysis of any problem areas that you have identified.
Mm.
And thirdly, you want to save the cost of having a consultant do the mock survey,
Hmm.
again, which can be expensive. So the second one I mentioned, the reason you would want to do your own, a consultant is not going to get into the root cause analysis as deeply as you probably need to go. Usually, if there are problems, it doesn't just involve one or two people or one or two processes. So by doing it yourself, you can really dig in deep and figure out what's going on that's causing that problem to pop up.
Okay. I guess the bigger discussion here today is, what is the point of these mock surveys? What are we really trying to drive at?
So, so the whole process of surveys is based on a concern about the quality of services that are being delivered to patients, right? So everything that happens in an agency has a certain level of quality that it needs to happen at for everything to converge at the right time, in the right way, at the point of the patient.
Mm-hmm.
So when a surveyor comes in, they are looking to see whether or not the agency's products and services and processes are able to bring optimal care to each patient. So they use a standardized approach, which is where the conditions of participation come in. Medicare has kind of defined what those requirements are and the level at which those things have to be present in an agency. They are also a surveyor is also going to look at, as I've mentioned in the past, they're going to look at state requirements. If an accrediting organization is looking at your agency, they're going to look at their standards. They're going to also look at whether or not you follow your own policies and procedures. So all of those are good places for you to, start out being aware what all of those quality issues are.
Mm-hmm.
And quality is what underlies everything that a surveyor is going to be looking at. I did want to digress a minute and give a little historical perspective, because I don't think people generally understand how far this whole process has come in the last 35, 40 years.
Mm-hmm.
In the 1980s, I was one of 9 home health administrators involved in a Robert Wood Johnson's funded study, and the whole purpose was to establish some quality outcome measures for the home health industry. And to my knowledge, it's the first really big study that was conducted. I remember going with a CHAP surveyor as a peer reviewer, which they used to have, they don't anymore, but I went on some surveys. And when we would ask an administrator or director of nursing, tell me about the quality of services your agency provides, it was always the same answer. They all provided better than average quality of care.
Yeah,
So
that's statistically impossible.
yeah,
So very interesting. And so you would be asking, okay, what do you mean by that? How do we map this out?
right. And at the time, we didn't have any objective measures. So
Wow.
there was no OASIS. There were no home health compare. There was, no Casper reports. It was basically, you know, it was assumed that every home health agency would try to do the very best possible for patients, but we didn't have
Mhm.
any objective measures at the time. So, as much as the industry now laments the processes that are in place, it does give home health agencies objective measures, objective standards to use to measure the quality of the services that their agency provides.
That's awesome. On the, as a patient or as a potential patient, I want to know that you're not just saying, well, we're doing really well. We're providing excellent patient care. I want to see those things. And
Exactly.
the cool thing is that, those who are doing it have nothing to fear except documentation, which, is super annoying. But if you're doing it, that actually shows that you are the top of the class, and that will help your marketing department tell that story, and that will help me as a patient choose your agency and appreciate your agency for what it is, instead of just thinking, well, I'll go down the street if I don't like you pricked me one too many times.
Um, you're pointing out something that's really true. It used to be that if the patients liked the people that were coming in and working with them, they thought the agency was great. They had no objective measure. And if I were going to have, some kind of surgery, I would really like to know that the surgeon that's doing my surgery actually has had good outcomes, right? So,
No, it only matters if he's nice.
or handsome or whatever,
Yeah.
or pretty. I don't want to be sexist here. Yeah.
Mhm.
so, so what we lacked in the home health industry in the 80s and 90s, until things became more systematic, we really didn't have very good ways to measure ourselves as an agency against
Mhm.
other agencies. So, one of the things that agency administrators and managers need to do is to become very familiar with their Casper reports. Some agencies only look at home health compare reports, which aren't really complete enough to give them the whole picture. Some agencies don't track the reports or know how to analyze them or how to incorporate that information into their quality assurance programs. And some actually never even look at them, which is a
Oh,
scary thought.
that seems like a wasted report.
Oh, yeah, there's a lot of really good information in those reports. So people need to become familiar with them and use that information.
So you mentioned like three or four things there. How does an agency look at their reports or resources? Where are those things collected? Do they have access to them now? Do they need to go get access?
Every agency has access to their own reports, and you do have to understand that they're not they're not released as regularly as we would like sometimes. Certainly, the COVID situation has interrupted some things, this year. When there's a change in standards or a change in the OASIS tools, that can kind of uh, get confusing. But the Casper reports include uh, four main reports that they want to get familiar with. First is the agency patient related characteristics. Secondly, risk-adjusted outcomes, which compares their agency nationally. Potentially avoidable events, which historically have been referred to adverse events, things like falling or rehospitalizations, urinary tract infections, or any other kind of infection, upper respiratory tract infections, that kind of thing. And then process-based quality improvement, which are the standards for best practices. So these reports give home health agency administrators and managers the same information. They have to understand this. This is the same information that a surveyor is going to have access to when they are preparing to do your agency's survey.
And that's the magic. You already have the answers.
That's the magic. You have been forewarned, and that gives you the ability to fix your problems before a surveyor sees what your problems are. And in fact, as a surveyor, I was always impressed when I found an agency that had found their own problems and fixed them before I got there. That to me spoke volumes. That told me
they're going places.
That process. Yes. And so, that was impressive. So
it's like dating. Everything's like dating. Let's just say it. Nobody's looking for the perfect person, but the guy or gal who can take an honest look at themselves and be working on it, the surveyor is going to be in love.
Yes, you're going to be really, impressed to see that there's a thought process going on that's being followed, systematically in that organization, where they can identify their own problems and get their best people together, to get their heads together, to say, okay, what's the root cause of this problem and how do we fix it? So by the time a surveyor gets there, usually it's kind of late and it's going to end in a citation and possible penalties. So it is a great idea to do a mock survey. A lot of agencies wait till 4 months or 6 months before they expect to have their survey. The problem with that is agencies usually are surveyed somewhat before the 36-month timeline.
Before their end date.
Yeah, before their end date, because whatever organization is involved in doing the survey, they have to have time to process the results, give the agency time to fix any problems before they reissue a certification. So a lot of times agencies are surprised and
that's the point.
They're surprised that they've got a mock survey planned, and then instead of the mock surveyor showing up, the actual surveyor shows up. So
what do you think is the sweet spot? Maybe a year out from your date?
As a surveyor, I would usually look at the previous 1 year to see what problems were being identified and the problems being followed through. If I saw that it was that there was a process in place, I usually didn't look too far back. So yeah, a year to me is a good timeline that gives an agency time, once they identify their problems, to put some things in place to fix those. If you do a good root cause analysis, you may find that your orientation process of your clinicians needs to be improved so that they're doing a better job at capturing OASIS, indicators. You may find that your education program doesn't contain all the required content. You might see your contracts are not up to snuff. There's so many things that you may need to attend to before you get to that last minute. And it does take time to make these corrections. So
give yourself the best shot.
Yes, give yourself some time. I would say, at least 6 months. But even before that is a good plan, because you may have to make some major changes. You may have to hire some new staff, train some new staff. So yeah, don't wait till the last minute, because you could be surprised with a survey before your mock survey happens. So yeah.
All right. Well, we're at the end of our time today. I see a handful of folks are watching. I know Janesh is out there, but I just want to make sure that you guys didn't have any questions of your own about mock surveys, or kind of the deeper foundations of quality, or what a surveyor is looking for, that the mock survey would help. If you do have questions and this broadcast has already ended, please still put them in the comment section, because Teresa revisits this and we use your questions to determine what we're going to talk about. And if you don't have any questions, we just pick something that we want to talk about. So
which is what we've been doing so far.
Yeah. So this is new, and you have the ability to influence some of the direction we go in the Q&A. So, mostly this is for new admins, new agency owners. If you are deep in an experience and have a question, we're not going to write you off, but we might dumb it down a little bit. Well, that sounded rude, but we might simplify it a little bit.
Simplify is a better word.
Because we really do care about the legacy of the home health industry, and helping the new people get their footing. But want to see your questions and comments, and thank you so much for joining us today. If you have not subscribed to my mama's Facebook page, this is a great place. We're trying to build community and be giving and other-centered, instead of keeping tight-lipped and closed down. And we want to be there for you guys as you're starting off. So also have a YouTube channel if that's easier for you. We have we can't name it yet. I think you have to get to 100 subscribers before you can claim the title, but we are the Home Health Mentor on YouTube as well. So thanks for joining us, and we'll see you next Friday for another Q&A Friday. Bye for now.
Bye.